Lower back and neck pain are among the most common health complaints, affecting up to 80% of adults at some point in their lives. With billions spent annually on spine-related care, epidural steroid injections, ESIs, have become a popular treatment for radicular pain and spinal stenosis. But do these injections truly offer meaningful relief? The American Academy of Neurology (AAN) set out to systematically review the evidence, focusing on both short-term and long-term effects on pain and disability. This video breaks down their findings and what they mean for patients and clinicians. Epidural steroid injections, or ESIs, are procedures where corticosteroids are injected into the epidural space around the spinal cord. They're commonly used to treat pain caused by nerve root irritation known as radiculopathy or by narrowing of the spinal canal called spinal stenosis. ESIs can be delivered through different approaches such as interlaminar, transforaminal, or caudal routes. The goal is to reduce inflammation and relieve pain, but the effectiveness and safety of these injections have been debated for years. Answer whether ESIs work. The AAN Guidelines Subcommittee reviewed randomized controlled trials published between 2005 and 2021. They included studies on adults with radiculopathy or spinal stenosis, comparing ESIs to placebo or other active treatments. The team converted various outcome measures into standardized success rate differences, making it easier to compare results across studies. In total, 90 trials met the criteria, providing a robust dataset for analysis. Patients with cervical or lumbar radiculopathy, ESIs probably reduce short-term pain and disability. The evidence shows that within 3 months, about 1 in 4 patients experiences meaningful pain relief, and 1 in 6 sees improvement in disability. However, these benefits are modest, and most of the supporting data come from studies on lumbar radiculopathy. The effect size is small to moderate, meaning ESIs may help some but not all patients in the short run. When it comes to lumbar spinal stenosis, ESIs possibly reduce short-term disability but not pain. The evidence is less robust here, with only a few studies available and results showing high variability. For cervical spinal stenosis, there simply isn't enough data to draw conclusions. So while some patients with lumbar stenosis may see short-term improvements in function, pain relief is not consistently observed. Looking at outcomes 6 months or more after ESIs, the benefits become less clear. For both radiculopathy and lumbar spinal stenosis, ESIs possibly reduce long-term disability, but the evidence is weak and confidence is low. When it comes to long-term pain relief, the data are insufficient, meaning we can't say for sure if ESIs help or not. It suggests that while ESIs might offer some short-term improvement, their long-term value is questionable. ESIs are generally considered safe, but complications can occur. Most reported side effects are minor, such as increased pain at the injection site or temporary numbness. Serious complications like nerve injury, infection, or even paralysis are rare but possible. The risk of adverse events increases with repeated injections, and long-term steroid use can lead to additional problems, including epidural lipomatosis. Patients and clinicians should weigh these risks against the modest benefits. The cost of ESIs justified by their benefits? The answer is unclear. Some studies suggest a small reduction in pain and disability, but no significant cost savings or improvement in quality of life compared to standard care. Additionally, ESIs do not appear to reduce the need for future surgery. With healthcare resources limited, understanding the true value of ESIs remains an important question for future research. The AAN review highlights the need for better studies, especially for cervical conditions and long-term outcomes. Future trials should use meaningful clinical improvements as their main measure and carefully select placebo controls. For now, ESIs may be considered for short-term relief in select patients, but expectations should be realistic. Shared decision-making between patients and providers is key, considering both the modest benefits and potential risks. Summary: epidural steroid injections offer modest short-term benefits for some patients with radiculopathy and possibly lumbar spinal stenosis, mainly in reducing disability rather than pain. Long-term advantages are uncertain, and risks, though generally low, should not be ignored. As always, treatment decisions should be individualized, balancing potential benefits, risks, and patient preferences. The conversation about ESIs is ongoing, and future research will help clarify their role in managing spinal pain.